Hello friends, welcome back to my channel with a new video, and this is a part 2 of the ventilator graphic video which we discussed last time, and we left at the scalars, the float time, the pressure time and the volume time, and let us discuss the pressure volume loops and what else we could discuss as far as the ventilator graphics are concerned. So let's start. So this is how the pressure and the volume loop looks like. So x-axis you have volume and the y-axis you have pressure. So as you could see that this particular ascending limb is the inspiration and the descending limb is expiration. This becomes the peak airway pressure and this becomes the volume, corresponding volume at the peak inspiratory pressure. Now this particular point where there is the exponential increase in the inspiratory volume and also the pressure is the lower deflection point, whereas this particular point from where the inspiration has a less exponential increase in the volume but increase in the pressure, and it will ultimately stop here, is the upper deflection point. And this particular area where the inspiration is starting after some pressure is obviously the PEEP. So this basic understanding of the pressure volume loop is required. So these are the types of breaths. As you could see that this particular breath where it starts from this point as inspiration and comes back as expiration, and it is a controlled breath. This where the patient is triggering, it is going negative pressure, and then there is initiation of the inspiration with expiration. So something looking like a fish is an assisted breath, whereas if it is looking like something like this loop, which is just like a standing loop with the inspiration and expiration, is a spontaneous breath. Now in this particular graph, as you could see, as I have already discussed, that this is starting after some pressure and that is the PEEP. In this particular pressure volume loop, you could see that the standard looking pressure PV loop, we call it as a standard looking PV loop, is actually inclined a little downward. It has gone a little down. So what happens is there is the pressure which is actually the it is little increased but with a less volume generation. Okay, so there is increase in the pressure, there is increase in the effort, and there is also a little bit of baking of this, and this happens classically when there is increased work of breathing. So from a distance on a ventilator screen, if you have this kind of appearance where the standard PV loop is slanting forward and a little downward, forward and a little downward, this is seen in increased work of breathing patients. So A is called as the resistive work. The A is the area which is, if you draw a line between the loop and the area below that is the resistive work, and the area which is above that line and in the expiratory phase is the elastic work. So this is another basic concept which everyone needs to remember to answer the Viva questions. So in this particular PV loop, you could see that this is the normal slope, and you could see that again this particular loop has bulged a bit, it has bulged, and there is definite slanting of the inspiratory limb forward, but without any increase, much increase in the peak airway pressures. There are increase in the peak airway pressures, but it is classically seen as a bulged kind of PV loop, and this is classically seen with the increased airway resistance. As we know that increased airway resistance, you can have high peak airway pressure and not that high plateau pressure. In this particular PV loop, you could see that it is slanted further down. So the pressure has also gone up, but the volume has come down. Okay, so this is particularly seen in decreased compliance. So it is very easy to understand. Pressure has gone up, whereas volume has come down. So the lungs are non-compliant, not generating that much volume, but definitely generating more pressure. So this is seen with a decreased compliance patient. In this particular PV loop, there is a clear-cut beaking of this apex or the apical point. There is a beaking, so volume remains the same, whereas the pressure has gone up, and this is classically seen in over-distension alveoli. So this is a over-distension of alveoli, and you could see a classical beaking. So anytime when you see a beaking appearance, it has to be a over-distension. Anytime if you see a slanting of that particular PV loop down, so the pressure has gone up but the volume has come down, it is a decreased compliance. Now this particular PV loop, you could see that inspiration is quite okay, but the expiration is not touching the baseline. Okay, so this particular kind of loop, as you could see, that there is no air which is counted, so probably there is a leak. So this is classically seen in air leak. In these particular PV loops, you could see that this is an inappropriate flow, and this is a example of active inspiration when there is a notch in the inspiratory kind of this line which is there in between. There is a notch in this. So if there is an inspiratory kind of notch, this is active inspiration, whereas this is a example of inappropriate flow, where you could see that the elastic work is more than the resistive work. Now coming to the flow volume loop, and as I said, this deflection is inspiration and this negative deflection is expiration. So this is tidal volume and this is FRC, this is PIFR and this is PEFR. So let us see few of the abnormal flow volume loops. So in this particular loop, the normal expiration should have been like this, but this is touching the baseline before than that of normal. So this is a classical example of air leak. Similarly, as you could see that in this particular flow volume loop, the expiratory loop is touching the baseline. It is not touching the baseline, but it is actually, there is some gap between this, and this is classically seen in air trapping. So it is not touching the baseline. And in this particular graph, as you could see, that inspiration is okay, but expiration, the PEFR has gone down and there is a scalloping of this expiratory limb. So if you remember, if the PEFR goes down, it is usually seen in obstructive airway diseases or bronchospasm. So there is a scooped out pattern which is classically seen in airway resistance patients. And in this particular loop, you could see that there are multiple interrupted expiratory wave unlike the normal wave, and this is classically seen when there is water in the circuit or air, there are a lot of airway secretions. So that's all, my friends. This is what my attempt was to discuss the common ventilator graphics. So I hope this will help the exam going students as well. That's all for now. Bye bye.